Okay, good afternoon, everyone. My name is Maura Canavan, and I am with the Community Health and Wellness Department at Suburban Hospital. Today, we are here to discuss some recent developments in Alzheimer's with Mr. Michael Smith from the Alzheimer's Association National Capital Area. We will have time for questions at the end, so please feel free to send them in the Q&A box as they arise, and we'll be sure to address the question. After the webinar, you will receive a link to the evaluation, and we greatly appreciate your feedback as it helps us in continuing our program and making sure it's fit for you. And this recording will be sent out in the coming days. So thank you all for being here, and I will now pass it on to Mr. Michael Smith.
Thank you, Ms. Canavan, and good afternoon. Mr. Watson, Program Manager with the Alzheimer's Association, is joining me, and he'll run the slides for me. So let's go to the first slide if we can. Okay, so this afternoon's program, Understanding Alzheimer's and Dementia, is designed to help you learn more about Alzheimer's and dementia. It features information from dementia experts and perspectives from actual individuals living with dementia and their care partners. And when we mention care partner, it's a term that many prefer over quote unquote caregiver, while the individual with Alzheimer's or other forms of dementia is in the earliest stages of the disease. In the earliest stages, people with Alzheimer's, other forms of dementia, may have an opportunity to chime in on their care, their future, having discussions about what their hopes and aspirations are in terms of treatment regimens, where they may end up in terms of assisted living, long-term care, things of that nature. So it's beneficial that we ensure that we're treating them as partners as we begin the caregiving journey. And this afternoon, let's go to the next slide. Let's talk about what we're hoping to cover and achieve. Number one, we're going to talk about comparing Alzheimer's and dementia. Secondly, recognizing how Alzheimer's disease affects the brain, list the risk factors of Alzheimer's disease, identify the 3 stages of the illness, recognize current Food and Drug Administration FDA-approved treatments, describe how scientists are working to advance research, and finally, name the resources that are available through the Alzheimer's Association. So let's first talk about the impact of Alzheimer's disease. Let's go to the next slide. It's a global crisis, and you're likely to hear more and more about it in your personal lives and on the news. And let me share a little bit of data. In the 2022 edition of The Economist, it describes the rising problem of dementia, and it was called, quote unquote, a global emergency. Someone in the US develops Alzheimer's every 67 seconds. And by 2050, this is projected to be over 33 seconds. Currently, there are 35.6 million individuals with Alzheimer's and other forms of dementia worldwide. 66 million people, the number will be increased to 66 million by 2030. As an example, here in the United States, we have an aging population. There's more and more of us over the age of 65. And in terms of the scope of the epidemic, over 6 million Americans currently have Alzheimer's or other forms of dementia. 1 in 9 adults aged 65 or less, 65 or greater have the illness. And in population 85 or greater, it's 1 in 3. And because women outlive men, 2/3 of women are likely to come up with Alzheimer's or other forms of dementia. Moving on. We have a bit of a test, and I'll just give you the answer. Worldwide, as I mentioned, there's a number of individuals. The answer to this question, it's 6 million individuals will end up with having Alzheimer's currently in the United States. So 6 million individuals. And as I said, that number is projected to increase to 33 million by 2050. Again, because of the aging population here in the United States. We also have another question for you, and I'll give you the answer. About how many Americans provide unpaid care for individuals living with Alzheimer's and other forms of dementia? And the answer to this one is currently there are more than 11 million Americans providing unpaid care for people living with Alzheimer's and other forms of dementia. Alzheimer's impacts caregivers both at home and at work. More than 80% of care provided at home is delivered by family members, friends, and other unpaid caregivers. Over half of employed caregivers report having to go in late, take time off, or quit altogether due to caregiving demands. These caregivers provide more than 16 billion hours of care in 2022, and that is valued at $272 billion. So as you can see, this disease takes a very personal toll and impact on individuals facing it, as well as a financial one. So let's learn a few more stats about the impact of the disease as we see this video and the facts. So as you can see, the stats and facts that were shared can be somewhat overwhelming. I'm surprised to see that Alzheimer's and other forms of dementia kills more people than prostate cancer for men and breast cancer for women. And it's also unsettling to see that discrimination, even in healthcare, exists whereby people don't have equitable access to healthcare. In instances where they do, healthcare providers often misdiagnose or underdiagnose certain ailments within communities of color. Now let's talk about Alzheimer's and dementia, because oftentimes people get them confused. And I know oftentimes we do use Alzheimer's and dementia interchangeably, but there is a clear distinction between what Alzheimer's is, which is a form of dementia, and what dementia is, which is more of an umbrella term. So let's go to that next section. Excuse me 1 second. On a call, I'll call you when I'm done. Bye. So sorry about that. Okay, let's go to the next slide. And let's talk about this. Is Alzheimer's a normal part of the aging process? And the answer to that is false. Alzheimer's disease is more than just a memory loss condition. It is a progressive and fatal neurodegenerative brain disease that kills nerve cells and tissues in the brain, affecting an individual's ability to remember, think, plan, and ultimately function. Another quick question for you, and I'll give you the answer. People younger than age 65 can develop Alzheimer's, and the answer to that is true. Most individuals living with the disease are older adults. People younger than age 65 can also develop Alzheimer's, and this form of the disease is known as younger onset Alzheimer's. One of the things I didn't share when I came on initially is that as a volunteer, I'm very passionate about doing community education, being a support group facilitator. I was a caregiver to my late wife. Bernita was diagnosed at the age of 56 with early onset dementia, and eventually in 2012 was diagnosed with actual Alzheimer's. And unfortunately in 2017, she passed away from complications of Alzheimer's. So indeed, people younger than 65 can develop it. Oftentimes it's because people may have earlier family members. In Bernita's case, my late wife was named Bernita. Her mother was diagnosed at the age of 84 with dementia. So conceivably, that was passed down from Bernita's mother to Bernita. We'll never know, and that I did not have an autopsy conducted, but there is correlation that if one has a direct family member, it's likely that their offspring, children in particular, may develop Alzheimer's or other forms of dementia. Let's move on to the next slide, which is going to talk a little bit more about the types of dementia. As I mentioned, dementia is an umbrella term. We're going to be hearing from Dr. Heather Snyder, which will go a little bit more in depth about each type of dementia.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So I hope Dr. Snyder's explanation gives some clarity to exactly what dementia is. It's an umbrella term. It's a general sense of symptoms of cognitive decline and deterioration, but there are specific types of dementia, which he had mentioned, okay? And now let's talk about the importance of an accurate diagnosis. We can play this video.
Certainly having the diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
As Gail mentioned, the caregiver having that diagnosis gives a word, gives a sense of what exactly it is, and it allows for an opportunity by having an accurate diagnosis to access treatment options, opportunities to get resources and support, and opportunity for more time to plan for the future. Okay, so let's just do a quick recap as we talk about Alzheimer's and dementia. Dementia, again, is a general term for a collection of symptoms that are severe enough to interfere with daily life. Alzheimer's is the most common cause of dementia, about 80% of cases. Alzheimer's is not part of the aging process, and let me underscore that. Alzheimer's and the other forms of dementia is not part of the aging process. Alzheimer's and other dementias are a progressive brain disease. Next, we're going to hear from and look at what the brain entails. So we'll have a little video that talks about inside the brain and how we came to discover it through Dr. Aloysius' Alzheimer's. So we'll go through those slides.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
Okay, so just a quick recap. Over 100 years ago, Dr. Aloysius Alzheimer described specific changes in the brain. Alzheimer's caused nerve cells to die, which leads to shrinkage of the brain. And the brain change results in memory loss, thinking problems, and behavioral problems. Okay, moving on. Let's talk about risk factors. Now, we hear from the Wizard of Oz, a little bit of joke, a little bit of levity. You know, the Tin Man talks about, if I only had a brain. But all of us, indeed, we have a brain. And therefore, having brains, we are at risk of developing Alzheimer's disease. There are a few known factors that increase a person's risk for developing the disease. Now let's look at one of the most common factors. So let's run that next slide. And I got another question for you, which I'll provide the answer. Which of these options do you think is at the greatest risk for Alzheimer's disease? Genetics, family history, or age? And the answer again is age. Genetics, that makes up about 5% of cases. Likewise, family history makes up 5 to 8% of cases. But the other predominant factor is age. As mentioned, there, those over the age of 65, there's the risk of developing Alzheimer's, which doubles every 5 years, and more than a third of people age 85 or older are living with the disease. Often it's not diagnosed, or it may be misdiagnosed. So we're not going to hear from another expert. We're going to hear from Dr. Snyder talking a little bit more about this issue.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So deterministic genes, stronger possibility is determined, as it says. Risk genes, you're at a likely possibility. Let's talk about populations that are at higher risk. In addition to the main risk factors for the general population, African Americans, Hispanic Americans, and women are at higher risk for Alzheimer's. Research has shown that African Americans are about twice as likely as white Americans to have Alzheimer's or another dementia, and in the Hispanic or Latino community, they're 1.5 times as likely. Some of that is related to health disparities, to biopsychosocial factors. Some people don't have access to health care. There is discrimination, as one of the slides indicated, in the healthcare field. So all of these factors, besides the impact of certain medical conditions on communities of color, higher incidence of high blood pressure, coronary disease, things of that nature. Also, in terms of women, women are more likely than men to develop the disease. Nearly 4 million American women are living with the disease today. We know that women live longer than men, making them more likely to develop Alzheimer's. However, longevity and lower death rates can only partially explain this difference. Researchers continue to explore how genetic differences between men and women may impact the disease risk. Okay, so moving on to the next slide, and it's just a quick recap. So to summarize, Alzheimer's disease involves the failure of nerve cells, the exact cause of which is still uncertain. However, research has identified risk factors that increase the likelihood of developing Alzheimer's. Age is the greatest known risk factor for Alzheimer's, as individuals' risk for developing the disease increases after the age of 65. And family history is also a known risk factor. Having a parent or sibling with the disease increases an individual's risk. And as I mentioned in my late wife's case, her mother was diagnosed in her mid-80s with dementia. That more than likely increased Bernita's risk, but we didn't know that at the time. And as Dr. Snyder mentioned in the slide, there are two types of genes associated with Alzheimer's: risk genes and deterministic genes. African Americans, Hispanic Americans, and women are at greater increased risk for developing Alzheimer's. So I just wanted to reiterate those facts. Now let's move on and talk about the stages of Alzheimer's disease. And let me emphasize as we go to this slide that no two individuals will experience the symptoms and progression of Alzheimer's or other forms of dementia in the exact same way. We're going to hear from some individuals who describe what it's like living with dementia. So let's move to that series of slides, videos.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel, so I've even stopped trying.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
I'm like an overachiever and when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
I think the thing that surprises me the most about my dementia is that it is progressive, and I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor's, and so that becomes a little disconcerting at times to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
So as we just heard, you know, these individuals are living with the early stages of the disease. Symptoms worsen over time for everyone. However, people progress through the stages of Alzheimer's and other forms of dementia at different rates as their abilities and functioning changes. On average, a person with Alzheimer's lives 4 to 8 years after diagnosis, but can live longer, as long as 20 years, depending on other factors. Okay, so just wanted to point that out. Next, we're going to talk about the progression of Alzheimer's disease from brain changes that are unnoticeable to the person to brain changes that cause problems with memory and eventually physical disability. So there's a continuum. And in the first phase, asymptomatic. In this phase, there may be changes in the brain, but there's no symptoms. And in my late wife's case, she was highly functioning. She was a social worker like myself. She was director of admissions and financial aid at Catholic University School of Social Work. She was a high functioning woman, but more than likely, she was beginning to have some issues. And they did emerge in 2008 when she came home and said, "Oops, I'm giving out the wrong admissions letter or the wrong financial aid packet," that sort of thing. And eventually, as I said, she was diagnosed, unfortunately. And as we see in individuals, and as we saw with those individuals that were just speaking about their frustrations and what have you, as the disease progresses, the person will begin to experience mild symptoms, but we'll see that it will impact their performance, their activities of daily living. And when it does impact the activities of daily living, then it starts getting into the various stages of Alzheimer's, other forms of dementia, the mild, the moderate, and the severe stages. In the moderate stage, people might forget words, they may forget names, they may forget where they are. In the latter stage, the severe stage, people then are having difficulties with activities of daily living. They may not be able to dress themselves, feed themselves, may not be able to walk, issues with incontinence, things of that nature. So there's a clear delineation between the various mild, moderate, and severe stages of the illness. And also, as it gets to the severe phase, people, not only in terms of thinking and memory, but their behavior, their personality changes. They may become more withdrawn. They may become agitated, things of that nature. So it's important to look out for those sorts of things. So let's quickly talk about a recap of the stages. There's 3 broad stages of Alzheimer's. There's the asymptomatic, the mild cognitive impairment stage. And then when we talk about Alzheimer's or other forms of dementia, the 3 phases of mild, moderate, and severe. And again, no 2 individuals experience the symptoms and the progression of the disease in the same way. And while symptoms worsen over time, people progress through stages at different rates as their abilities change. I've often seen friends that will say, well, my mom has Alzheimer's and she's doing X, Y, Z. And then somebody else says, well, my grandmother has Alzheimer's and she's really deteriorated really rapidly. I wonder what's wrong with grandma. And again, you can't compare apples to apples when we're talking about this disease because it's going to affect us differently and we will be impacted over the course of time at different rates and in different ways. So let's talk about what's available in terms of food, drug administration approved, FDA approved treatments. If we can go to that slide. As we discussed earlier, current medications cannot cure Alzheimer's. So unfortunately, there is no magic pill out there that's going to cure Alzheimer's or other forms of dementia. But there are treatments that change the disease progression. There are also drug and non-drug options that may help treat symptoms such as memory loss or confusion. There is one drug that came out last year that the FDA approved, and this past spring, the Centers for Medicare and Medicaid Services gave approval. It's called Leqembi. Leqembi is an infusion treatment. It has to be given at least twice a month. It is very expensive. It is close to $29,000 a year. For some individuals, being able to go to a healthcare provider or an infusion center, that frequently can be very problematic, but it does buy time. And the cases that they were studied, 27% of those with Leqembi had a rate of at least 12 to 18 months of being able to function at their current level. And in buying time, there's more quality of life during a period of time, opportunity to plan for the future, for one's finances, legal arrangements, things of that nature. And also, in terms of the medicines that are treating symptoms, treatments may be administered by pill, patch, or intravenously. In my late wife's case, she did struggle with depression. She was on antidepressants. She also went through an agitation phase. Unfortunately, we had to, after trying cognitive behavior therapy, which didn't work because her cognitive functioning was declined, the neurologist decided to give her an anti-agitation medication. Okay, so let's go on to the next slide. I think Michael's already there. That talks about the different stages and phases. So just to give you a quick sense, so in 1996, Aricept was approved, Exelon 2000, Aduhelm was a drug in 2021 that FDA initially approved, and then there were some issues about the clinical trials and whether or not it was truly efficient and if the efficacy was there. And then in 2022, Leqembi, which is not on this slide, and as I mentioned a moment ago, in 2022, the FDA did approve it earlier this spring. The Centers for Medicare and Medicaid Services gave its approval, and so it's available. But again, it's expensive. It needs to be given through infusion treatment. So let's move on to the next one. It's important to talk to our healthcare providers because everyone experiencing Alzheimer's deals with it differently, and treatments might help in varying degrees. It might not be effective for everyone. So again, talking about your own unique circumstance with your healthcare provider, they can ensure that they're tailoring the treatment to meet that individual's need. We encourage people who are interested in learning more about treatments to have a conversation with their healthcare provider. In getting an early diagnosis, there's the opportunity to be involved both in clinical trials and clinical studies. Some of the studies or trials may be non-medicine, so they may be looking at how do you continue to have language acquisition? Are there techniques to help with what's called working memory? Things of that nature. So let's move on to the next slide. So talking about advancing Alzheimer's research. Let's hit on these points: instigating early intervention, exploring lifestyle factors, moving towards a cure, and securing funds for research. So we'll click on each one of these.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease is a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
Growing evidence indicates that people can reduce their risk of cognitive decline by adopting key lifestyle habits. More and more research shows that factors like exercise, nutrition, and aggressive management of cardiovascular risk factors may impact our ability to slow cognitive decline as we age. And through current studies, we're exploring how certain lifestyle factors may even reduce the risk of developing Alzheimer's and dementia.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. Even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day. And I know we're getting closer for that cure. Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
So as we heard the last decade, researchers have made enormous strides in understanding how Alzheimer's disease affects the brain. Many recent insights point toward promising new strategies for treatment, prevention, and diagnosis. And there is a lot of hope. Not only are researchers continuing to look at amyloid plaques. Amyloid is a protein that gets it's like glue. It gunks up the neurons that are transmitting data within the brain. They're also looking at issues around inflammation and other factors that might cause Alzheimer's and other forms of dementia. So they're looking at also new ways of treating Alzheimer's, and there are many drugs that are in the research pipeline. Recruiting and retaining trial participants is now the greatest obstacle, other than funding, to developing the next generations of Alzheimer's treatments. So we're going to hear from some more experts that are going to talk about the importance of trial match and clinical trials.
Participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
You might hear the phrase negative trial, which means it didn't hit the endpoint. It didn't result in an FDA-approved treatment for the disease. But I think the only negative trial is one that doesn't provide us with valuable information. If the trial is well designed and is a good scientific experiment, we can get extremely valuable data that can help plan the next trial and make it even better than the last one. And it gets you that much closer to that FDA-approved drug, to that effective treatment, and maybe someday even prevention.
By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
Okay, so just to quickly recap, scientists have increased their understanding of Alzheimer's significantly in the last decade. People living with the disease, caregivers, and healthy individuals without dementia are needed to participate in clinical studies in order to find methods of prevention, treatment, and ultimately a cure. And let me also, given the greater increase in risk factors for people of color, we need more African Americans, we need more people of color in the Latino population, also even more women in these clinical trials and clinical studies. Both drug and non-drug studies are taking place across the country. And here in the Washington area, we're blessed to have major research institutions like Johns Hopkins, like Georgetown, like GW, like Howard University. And so making sure through the Alzheimer's trial match and other resources that the Alzheimer's Association can provide, that we can get engaged in these clinical studies, which, as was mentioned, the studies can provide participants with cutting-edge treatment and additional medical care. And Trial Match through the Alzheimer's Association is a free program matching services for people interested in participating in Alzheimer's research. Alzheimer's is difficult. However, no one has to face the disease alone. So now we're going to hear a little bit more about the Alzheimer's Association. And if you've not been aware of it, we do have a lot of information, a lot of resources that are free and available through our helpline 24/7, 24 hours a day, 7 days a week. We have chapters all over the country in the 48 contiguous states, as well as Hawaii and Alaska. And I, as part of being a caregiver, taking care of my late wife, Bernita, on occasion did reach out to the 24/7 helpline in the middle of the night when I felt frustrated, during the day when certain techniques in trying to take care of her weren't working. Also seeking guidance on support groups, which were invaluable, realizing that I was in a community, a safe space, where I could talk about my frustrations, learn some practical tips from other caregivers, and learn about the additional resources online through the Alzheimer's Association. So again, we have a 24/7 helpline. We have trained counselors. They can speak any language that is needed. They can help with care planning. They can provide information on decision-making support, crisis assistance, resource identification, things of that nature. Our alz.org online. We have tons of information. There's a whole section on help for caregivers, our SAFE program, how to, if a family member or a loved one is wandering or dealing with sundowning issues, how to address those kinds of issues and dynamics. So why don't we wrap it up here so that we can open it up and have a conversation and address any questions that individuals might have.
Thank you so much for that wonderful presentation. Yes, so we are now open for questions. So please, again, put them in the Q&A box if you have any. But I guess, I can start with a general question. What would you say is the biggest misconception that you've heard surrounding Alzheimer's disease?
I think the biggest misconceptions, Morta, is that it's typical aging. And in some communities, sometimes there's in some Asian communities, there's not even a word that describes Alzheimer's or dementia. It's analogous. In some instances, they're saying, "Oh, the person's quote unquote crazy," or in some other communities, there's a sense of it's just part of the normal aging process. And as I mentioned during the course of the presentation, Alzheimer's and other forms of dementia is not part of the normal aging process. It's a neurodegenerative brain disease. And so if we're seeing family members exhibiting signs of potential cognitive decline, it's imperative to get them into a healthcare provider for an assessment and diagnosis. In some cases, it could be a treatable medical condition. It could be an issue around hypertension, possible stroke, other forms of brain trauma that are exhibiting some form of cognitive decline, and those things can be treated. Unlike, unfortunately, Alzheimer's, in terms of there's a cure, if you will, for managing other medical conditions versus Alzheimer's and other forms of dementia.
Great, thank you. And that brings us to our next question. What tests do you recommend to identify the specific kind of dementia?
So oftentimes when we go into our either internist or family practitioner, they're at the front gate, so to speak, of providing us care. And hopefully they are qualified at making an initial diagnosis. They may seek our medical histories. They may seek information from family members. They may run blood, urine, spinal tap, or they may refer us to further specialists, like a neurologist or a neuropsychiatrist or a geriatrician, which may offer further testing, such as a spinal tap, which may indicate that there's amyloid plaque in the blood system. They may do a CT scan or an MRI, which will assess the brain and will see deterioration or shrinkage of the brain in those areas that have been impacted. So typically, it's important to have a comprehensive medical assessment, one that, again, as I mentioned, your medical history, an actual exam, blood work, CT scan, MRI, and that way, through a comprehensive assessment, the physician or the medical team can make an appropriate diagnosis and treatment plan.
Thank you so much for that. And then next question, what would you say is the newest piece of research you've heard lately, kind of as, any recent breakthroughs or anything new, like new medications? I know you had the timeline, but is there anything new you've heard that's coming out about Alzheimer's disease?
Again, besides looking at Leqembi and those sorts of medications, they're looking at what factors might be correlated to issues around inflammation in the brain, things of that nature. And I will also invite Mr. Watson to chime in on responding to this question as well.
So I won't answer it from the medication standpoint, but what we will say is that in one of our other presentations, Healthy Living for Your Brain and Body, we've seen a lot of success and improvement for individuals pre-diagnosed and those with the diagnosis with their food. So something that Mr. Smith and I discuss a lot is the Mediterranean and the DASH diet. So what we put into our bodies being a key indicator of how we look at health overall for those individuals who are not diagnosed with the disease, but individuals who are diagnosed with the disease, making sure that we change the dietary restrictions or making sure they don't have a sedentary lifestyle. So those two diets the association recommends as a precursor for someone who is concerned about maybe developing the disease, but those individuals are diagnosed, they do see some cognitive improvement. Not much, but a significant amount to some degree for those individuals who do switch their diets by eliminating some of that fatty foods, trans fat, MSG out of their diets as well.
Thank you. And that was the Mediterranean diet, and what other?
The Mediterranean diet and the DASH diet.
DASH, you said?
Mm-hmm.
Okay. Thank you. Okay, so another question in the chat. Someone is 70 and nearly every person they know experiences memory and concentration issues. You know, they assume not everyone has Alzheimer's, but what is behind all of this?
So great question. Here's the reality. As we age, there is some challenges with our function. We may forget names. We may forget dates. We may forget where we placed our car keys or why we went into a certain room to get something. But then we can quickly say, oh, that's right. I left my car keys, which I typically put on my bureau. I left them in the kitchen because I went to turn off the light. And you can retrace your steps and go back and get the keys. You may forget somebody's name, but then you say, oh, that's right. I met you at church. Or, because sometimes memory is kind of contextual. It's like if I saw somebody at church, but I see them out of context, I see them at the grocery store. So, forgetting somebody's name, maybe a few moments to recall a particular word, but we can, again, eventually, after a few seconds, that's the word I was looking for, the proverbial tip of the tongue sort of dynamic. Those are typical in terms of aging. However, when somebody is almost on a daily or chronic basis, forgetting where they have put their keys, putting their purse in the microwave, accusing somebody else of stealing their keys or something of that nature, when it impacts on a more consistent, repetitive basis, then that's a cause for concern in terms of, is there indeed some cognitive issue that needs to be addressed? I hope that helps.
Thank you. Thank you. Okay, our next question, as far as donating to the cause, what is the difference? What is the difference between the Alzheimer's Association versus Alzheimer's Research Association slash foundation?
Mr. Watson, you want to take this question?
Yeah, so with the association, the donations that you are giving to us goes directly into the work that we're doing today. So that goes directly into the fundraising and development arm of the Walked In Alzheimer's, the Longest Day, a program that's in June that also goes to funding our education programs that we put on for free as well. And it goes to another component. The foundation is a different branch of the arm. So it's not, although we are connected, it's not, the funding doesn't go to those same pockets. If you're donating to the association, it goes to the pillars of development and to the care and support team, but the foundation goes to the research side of the house. So there is the separation. The foundation focuses more on the research. The association focuses more on the ground aspects of the day-to-day work for the association.
Thank you so much. So our next question, do you have any insight? What are institutions doing about providing a Mediterranean or DASH diet for their Alzheimer's / dementia patients?
So, hopefully, whether it's a memory care unit in an assisted living facility or a nursing home, their nutritionists hopefully are very aware of the Mediterranean and the DASH diets. And I would encourage you, if you have a family member that is in, an assisted living or memory care facility, to ask them exactly, do they provide the DASH diet? Do they provide Mediterranean? Mediterranean, typically olive oil, a lot of vegetables, a lot of lean meat. There's no polysaturated, the fried chicken and the processed foods that, truly are unhealthy for us. So yeah, I would encourage you to raise that question with wherever your loved one is.
And I'll add on to that quickly, Mr. Smith. We are in the process, from the association standpoint, of having a lot of these facilities be dementia care certified. Basically, it's a process that is for free that we put on trainings for these different organizations, these different centers, to say, okay, when you're bringing someone with Alzheimer's or dementia into your care, here are the steps and the approved measures that we would like you to take. And learning how to best interact with this individual, workouts are suggested, tips and tips to do for them from a physical standpoint, and to that point of the question that's being asked, diets. So there is a full round effort from the association standpoint to get a lot of these different centers, adult daycare centers, nursing homes, facilities up to date on how to interact, how to care, and the different things they can do to have a better overall experience for individuals that they're receiving with memory care issues, dementia, Alzheimer's, and any of the forms of dementia.
And just to clarify, so DASH means Dietary Approaches to Stop Hypertension. So that's what the acronym stands for. And the DASH eating plan basically is, again, strongly encouraging people eating vegetables, fruits, and whole grains, including fat-free or low-fat dairy products, fish, poultry, beans, nuts, vegetable oils, eating foods that are high in saturated, limiting foods that are high in saturated fat, such as fatty meats, full-fat dairy products, tropical oils such as coconut, palm kernel or palm oils, and limiting sugar. So those are some of the critical things when it comes to the DASH diet.
Great, thank you. And can we, is there information on the Alzheimer's Association website about these suggested diets?
Yes, and I can definitely send you a follow-up email to disseminate to the group as well.
Great, thank you so much. I'll be sure to send that to everyone. And then I guess another follow-up question on the testing and the comprehensive, exam. Would you suggest, at a certain point when individuals experiencing some symptoms that they go, they seek medical attention, or a certain age that they just do a routine check? Is there any recommendations on that?
So I would strongly encourage, if an individual for themselves or again family members are noticing someone with cognitive issues, to get to a healthcare provider as soon as possible so they can do a full assessment and determination. Again, it could be something else. Believe it or not, somebody with a urinary tract infection can exhibit some issues around cognitive decline. Somebody who's drank too much, they're close to alcohol toxicity, that can contribute to cognitive decline. Somebody who may have had a stroke may be exhibiting signs of some form of cognitive issues. And so getting into a healthcare provider so that they can do the diagnostic workup, they can say, oh, yes, you've had a stroke. Let's treat the stroke. Oh, my goodness, you've been drinking too much. Let's restrict or even stop your alcohol intake. Somebody who might have chronic massive depression may also have issues around cognitive decline. And all those medical conditions are treatable. And there could be marked improvement once those issues are addressed and treated.
Great, thank you so much. Well, we don't have any other questions in the chat. Oh, wait, hold on. Oh, okay. Last question. Is the Alzheimer's Association aware of the recommendations for Dr. Dale Bredazine?
Michael, you want to address that? I'm not sure who Dr. Dale Bredazine is.
Yeah, I'm not aware of any recommendations, but we can always take a look. But no, not at this time. We're not aware of any recommendations.
Thank you, and we can always follow up as well with that. Okay, well, thank you all for being here. I would like to, say thank you to Mr. Michael Smith. The presentation was amazing. You have lots of insightful information for the group, and for Mr. Michael Watson as well for leading the group in the slides. And thank you everyone for being here on this webinar to learn more today. So thank you, and I hope you have a great rest of your day.
Thank you for the opportunity to present. Happy holidays, everyone.
Thank you.